Hi everyone, welcome back to my YouTube channel, and today we are going to talk about chronic alveolar abscess. So let's start our topic with introduction. Chronic alveolar abscess is a long-standing localized infection of alveolar bone at the apex of the tooth, usually associated with pulpal necrosis or chronic periapical inflammation. Unlike acute abscesses, chronic alveolar abscesses often progress slowly and are usually asymptomatic, but may lead to fistula or sinus tract formation that allow pus to drain into oral cavity or skin. Definition: Chronic alveolar abscess is defined as persistent localized infection of periapical tissue of non-vital tooth, characterized by formation of sinus tract or fistula and minimal or intermittent symptoms. Etiology: Chronic alveolar abscess usually develops due to untreated pulpal necrosis or inadequately treated periapical infections. Causes include pulpal necrosis, untreated acute apical abscess, iatrogenic factor, and trauma. Pulpal necrosis. It is most common cause bacterial toxin from necrotic pulp chronically irritate periapical tissue. Second is untreated acute apical abscess. It is acute abscess that may become chronic if drainage occurs and systemic symptoms resolve. Third is iatrogenic factor, that is incomplete root canal treatment or overfilled canal. Fourth is trauma, that is chronic irritation from fracture or luxated teeth. Pathophysiology. Necrotic pulp allow bacteria to reach periapical tissue. Inflammatory mediators cause slow bone resorption at the apex. Pus formation occurs, but pressure is relieved through a sinus tract or fistula, preventing acute symptoms. Chronic inflammation may lead to granulation tissue formation and sometimes periapical granuloma or cyst. Clinical features of chronic alveolar abscess. It includes symptoms, signs, and tooth symptoms. Symptoms are: it is often asymptomatic or mild discomfort is there. There is occasional pain or tenderness if secondary infection occurs. Second, there are signs that include sinus tract or fistula on the gingiva or alveolar mucosa that is present often near the apex of affected tooth. Second, there is discharge of pus which may relieve pressure and pain. There is tooth that is usually non-vital, and there is minimal or no swelling unless secondary infection develops. Tooth examination include percussion that may show slight tenderness, and tooth may have previous restorative work or decay leading to pulp necrosis. Radiographic features: well-defined periapical decency at the apex of the affected tooth. Borders may be corticated indicating chronicity, and bone surrounding the lesion may appear sclerotic. Sinus tract occurs may sometimes be traced using gutta-percha points radiographically. Microbiological factors include mixed infections are common, predominantly with anaerobic bacteria, facultative bacteria. Anaerobic bacteria include Porphyromonas, Prevotella, and Fusobacteria. Facultative bacteria include Streptococcus species. Chronic inflammation is maintained by persistent bacterial toxins. Differential diagnoses include periapical granuloma, that is chronic lesion without sinus tract, periapical cysts that may have similar radiographic features, periodontal abscess that originate from periodontal pocket, and odontogenic tumors or bone lesions that are rare but considered in large or atypical lesions. Management includes elimination of infection, that include root canal therapy, that is first line treatment to remove necrotic pulp and disinfect canals. Extraction may be indicated if the tooth is non-restorable. Second management strategy is sinus tract management. Sinus tract usually resolves spontaneously after successful endodontic treatment. Surgical excision may be required if it persists. Third management strategy is antibiotics, that is generally not required unless there is secondary infection or systemic involvement. Fourth management strategy is supportive care, that includes warm saline rinses and patient education on oral hygiene and follow-up. Prognosis is excellent if the source of infection is eliminated. Healing may take several months with bone regeneration at the apex. Untreated chronic alveolar abscess may persist indefinitely, causing bone destruction or secondary acute infection. Clinical significance: Chronic alveolar abscess is a common endodontic problem that may remain unnoticed due to minimal symptoms. Early recognition and treatment prevent chronic bone loss, tooth loss, and systemic complications. Sinus tract formation provides a natural drainage pathway which may mask the severity of underlying infections. Conclusion of this lecture video. Chronic alveolar abscess is persistent, low-grade periapical infection that is often associated with non-vital teeth and characterized by sinus tract formation. Diagnosis rely on clinical examination, pulp testing, and radiographs. And treatment involves root canal therapy or extractions. Early intervention ensures resolution of infection, healing of periapical bone, and preservation of oral function. And this was all about chronic alveolar abscess. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.